Okay, good morning to everybody. Now that the magic number of 100 participants has been reached, I think we can start. Somebody will join in the next very few minutes. So my name is Andrea Giustina. I'm the co-chair of the Hypoparathyroidism Patient Forum. With Nathalie Grosset, who is with me in this very short welcome and introduction section. The idea of this forum has been, I think, one of the most brilliant initiatives of my term when I was president of the European Society of Endocrinology. The idea at that time was the society was interested to advocate for patient needs at every level, and the hypoparathyroidism patient organizations were at that time very convincing in my respect that their needs were very important. Obviously, I knew it by experience, but really it was a pleasure to start working with the patient organization for an initiative that was built up together with the patient. So the originality of this initiative is not just because we speak about patient needs, about clinical aspects of the disease, but I think one of the real unique initiatives in which patient and clinician in a really joint effort across Europe put together their experiences, their expertise, and provide an opportunity for every patient to interact with the clinicians and with other patients on their disease. I think this is one of the secrets of this big success that the webinars we organized in this context were so attractive for many patients and also to clinicians who are interested to know more about the needs of the patients. Next slide. This is to mention that this is the third initiative. We started in 2022. Obviously, the preparation took a lot more, so I think is at least 4, if not 5 years that we are working on this, and I think that the EC team, in particular Magda, who is the engine of this initiative, has to be acknowledged for the efforts to make these initiatives successful. As you see, we started in March 22, and then we had a webinar more or less in the same season of this year, in October last year, and the recordings of these meetings are available on our website in the patient zone. Next slide. And clearly, we are not alone with Nathalie working on the program of this forum, but I need to acknowledge Heidi, who is a very esteemed and good friend, very expert in hypoparathyroidism, and she put enormous enthusiasm in this initiative and put her knowledge at the service of this group. And also Tanya Richter as the co-chair with Nathalie Grosset about the patient representatives in the committee. And clearly, I have to acknowledge also the very important role that this patient organization that you see here played in putting on the table their needs and really contributing to the development of this initiative from the beginning, and clearly also to the success of all our meetings so far. Next slide. And really, this is not the only initiative that ESE has for hypoparathyroidism and for patients with hypoparathyroidism. In effect, I started several years ago this PARAT program, which is one of the most successful initiatives of the ESE on parathyroid disorders. And in that context, the patient guide and a patient guide more detailed for specific situation in patients with parathyroid disorders are also available on our website. Next slide. Also, I would like to remember in this occasion the European emergency card for adult patients with hypoparathyroidism, which is available for download from the ESE website and is translated in now 15 languages so far. Next slide. We are working clearly also on the professional side with the clinical guidelines that have been particularly successful, but I've already almost 10 years, and therefore an update of these guidelines will be presented next year at the Joint Congress of the European Society of Endocrinology and the European Society for Pediatric Endocrinology. And based on the revised guidelines, also new patient education leaflets will be produced. Next slide. Now, having said that, and I think having reported to you the history of this initiative, the importance, the originality of this initiative that we really have the pleasure to develop and to implement together with our patients and the patient organization. Just a few information about the housekeeping of the meeting. In effect, one of the other secrets of the success of this meeting is the availability of simultaneous translation that for this year, based on the participation of the patient to the previous forums, will be into French, German, and Romanian. The sessions are translated simultaneously live, and to choose your language, click on interpretation button, the icon with the globe at the bottom of your screen, and choose the language that you want to hear. If you follow the event in English, there is no need to choose a language channel. Next slide, which I think will be my last slide, which is exactly what I have said to you in English, repeated in the languages that will be translated, the English will be translated into. So I think this is my last slide. The practical information are here. So there are several buttons in the Zoom call. There is a question and answer. We have some questions that we asked the participants to prepare and to send us, but if you want to ask questions throughout the conference, can use this button at the bottom of the screen. The question will be discussed during the dedicated time, and hopefully your question will be chosen for discussion among the many that we receive, there will not be the opportunity to have an answer to a question that is not discussed at the meeting. Use the chat button only for technical questions. So if the connection is not working, other things that can be solved by our team, and please I would like to keep you informed that the questions submitted in a language different than English will be translated using the artificial intelligence and will be put back in the question and answer box in English. And finally, the session as the others that we held last years will be recorded, and the recordings will be available on our website, I think at least in a 4 week time. Finally, we would like to note that, and this is very important, this conference is not for giving medical advice. Obviously, there are a lot of patients in need of this kind of advice. This meeting is not the right place for asking specific questions related to specific circumstances that interest the single patient. This question has to be asked to the doctor that is following your condition, who is the one allowed to give you specific medical advice. Okay, so having said that, I think that I also concluded this brief session about the housekeeping of the meeting, and this is my great pleasure to pass the microphone to Nathalie Grosset, and I think that this will be a very interesting, lively session, and wish you all a very good Saturday morning of work. Thank you, Nathalie. The floor is yours.
Thank you very much, Andrea, for this introduction. Next slide, please. So this year, Hypoparathyroidism Patient Forum webinar, we needed to find new topics. And after discussing, we had a lot of different topics coming up, and we also discussed with Hypopara UK and Hypopara Norway to try and find what topics would be the most relevant to patients this year, knowing that we have already covered other topics the previous 2 years. So we thought that maybe this time we could work a little bit on how it was for the family, how it impacted our social life, how it impacted our family life. And we also thought that with the new treatments that are coming along, well, it was nice to have a topic on that specifically. And we also found out that we had a person that was very knowledgeable in calcium and nutrition. And therefore, we decided as well to introduce this topic this year. So we do hope that it will be of interest to all of you. And as we like to say, hypoparathyroidism is a hormone deficiency. It is not just a calcium problem. Next slide, please. As every year, we like to present to you the different hypopara organizations specific to hypoparathyroidism that we know of and that exist in Europe. So we have no new ones this year, and we hope that on next year's session, hopefully there will be a session next year, we will have a new one to add on here. We had Romania that was new last year with their group, and we obviously still have Parathyroid UK, and Helen, welcome as well on board as a new, I think, chair that will be coming along. There is also obviously Hypopara France, Hypopara Germany, Hypopara in Norway, in Italy, in Spain. So please remember that these organizations are very important because they help research and they help develop knowledge on the condition within your own country. And next slide, which will be the last slide. This is today's agenda. And so we will be just jumping into it right away with, first of all, the hypoparathyroidism and the long-term issues with Dr. Tanya Sikyair. I can't say the names. Then we'll have a parent, a couple, and a daughter talking. And then we will go on to session 2 just after a break with the nutrition and the new treatments. And the session will end at 1 p.m. CET time. And there'll be loads of time for questions and answers. So thank you.